Today we announced a unique partnership, one that we believe is the first of its kind, where our healthcare partners, University of Kansas Health Systems and LMH Health, have come together with KU Athletics to form Kansas Team Health. And this new partnership will oversee all the medical care of our student athletes. And for the first time, in addition to physicians, athletic trainers, nutritionists, other wellness providers, strength and conditioning coaches will now be a very important part of this medical supervision. And we do believe this is the first of its kind in major college sports. So we're excited to share this model and hope that others will see the value in it and also come to us, and we'll be happy to share with them how we're doing it here at the University of Kansas. We're driven by really wanting to provide the best health care possible for our student athletes. We have nearly 500 student athletes here at the University of Kansas, all of them competing, training, and working extremely hard. And obviously they have times when they need care and attention from our physicians and athletic trainers and our strength coaches. So this is the first time to have all of those practitioners under a medical supervision, not a supervision of Kansas athletic administrators or coaches. Having the medical professionals supervising makes sure that our coaches know their student athletes are getting the greatest care, and also the parents and the student athletes themselves know that they're getting the best possible care. Their care is being directed by experienced medical professionals and not coming up through athletic administration. And I think that's very, very important, and I do think it's the model of the future. We're just incredibly proud to be able to do a partnership here. It's a partnership that really engages the University of Kansas, Kansas Athletics, the University of Kansas Health System, and LMH, our local provider. And bringing all those entities together really is a monumental thing, a thing that has taken months and months to do. As we all know, medicine is the most complicated organization, and athletics is complicated in its own right. So be able to bring all those people together is a wonderful triumph, and I really do think we're at the beginning of the advent of the new way of providing medical services to our student athletes. You know, there's a risk management component of this as well, and we all rest assured that, you know, all of our student athletes are being treated and with the best medical practices available to us today.
It's really been 2 years in my mind in thinking about this, from May of 2017 when I was selected for this role. Obviously coming out of the health system, being so aware of all the work that we've done with the Chiefs, with the Royals, with the high schools, middle schools, the Speedway. I mean, we've developed this expertise over 15 or 20 years. And to have the opportunity to bring that with our local partners to our student athletes is just incredible. And leveraging the excellence of both, right? And so LMH Health has been a great partner for decades for our athletics department as our local provider, and they've been very invested, and they've done an excellent job with us. But really being able to take it to the next level with the health system, you know, it's not just sports injuries, it's health. It's the whole health of our student athletes. And so being able to leverage the assets of both of these organizations, we can be really proud when we go out and recruit that student, when we talk to that parent and say, you are going to get world-class care for your student athlete if they come to KU. And that's going to help us on the recruiting side as well. As a leader of this institution, I'll certainly probably sleep a little better at night, knowing that we have the strength of these two institutions behind our health care for our student athletes, as we, you know, almost feels like month after month see a problem arise at different institutions across the country. I'm confident we don't have those problems, but I also am very confident we will never have those problems now with this new arrangement.
You know, it feels great. It feels great to be a part of this unique collaboration. It feels great to be continuing our long service with the university and their athletes and the coaches. You know, I think this partnership with the University of Kansas Health System is a unique solution to a complicated problem. And so we're very proud to be a part of this. We, being LMH Health and Ortho Kansas, our partners, have been taking care of these kids, to use your expression, these student athletes. It's easy to forget that they're kids, right? and for almost 40 years. And so we're literally right down the hill from KU, a mile. And so when they have an emergency on the field or they have an injury on the field, we're there. And to be able to continue that service and to continue this relationship is just terrific. I think the important thing to know is that this was a very innovative and frankly courageous step for the university to take. And we've seen so much in the literature about situations where people waited too long to get the right model, the accountability, and a medical model at the forefront for these kids and their health. So I think the thing I want people to know is that idea of having these young athletes at the center of this is really what we hold true. And I think that this partnership is very much committed to that. I think we're really just scratching the surface. And over time, this is going to get better and better, and we're just very proud to be a part of it.
This is a great day, just a great day. This is, you're right, we've been talking about this for a long time. And as I said in my remarks, the reason we're all here today is because of Chancellor Doug Girod. And it's not like these conversations didn't occur in the past. The fact of the matter is when you got Doug, who's got a medical background, who walks into this position, and what you got to love about Doug is when he sees an opportunity, he goes all in. And so he really knew that there was not any trouble here, but in fact a better way to do this. And why not have the University of Kansas become the model and the best practice across the country? And then he tasked us collectively to come up with this. And that's the model everybody heard about today. If you pay attention to any stories these days, all the press is negative. I mean, there's just a story about Ohio State. You know about all the other schools in Maryland. You know what's going on in these places. And so first I would suggest everybody needs to kind of look inside first to see what's going on in their own shop. And while they're doing that, we're going to be sitting here putting together a best practice model. And I truly believe people are going to be coming here to Lawrence, Kansas and going, now, what did you do? And how did you do it? And how do we take it home with us? Part of it is kind of understanding what your skill set is and what your knowledge base is. And the thought of having an athletic department administration be responsible for the health care of the student athlete, it's just not a skill set. So why wouldn't you want to have a healthcare model and healthcare experts partnering with your athletic administration to make sure we're doing the right thing for the student athlete? If I was them, I'd sleep a whole lot better as well. It's hard to put into words what today feels like because, you know, we're with professional teams, we're with high schools, we're with middle schools, and today we add collegiate athletics to the fold, right? And so you kind of have the entire spectrum now. And that's what's so exciting about this, and for it to be your home university, right? Not as an alum, but as the CEO of the University of Kansas Health System. We share a name, actually we've got some of the board members or folks from the university. This is incredible. It's just another great day for our organization and I think for student athletes.